Good evening, everyone. First of all, I would like to thank the organizers for giving me a chance. Thank you, Siroi sir and Dr. Solanki for the late entry and allowing me to speak. Most of the job has been done by Dr. Jakhan and Dr. Soni. Just going to share my cases in which I've done percutaneous spinning in distal radius fracture. I practice in Dehradun. I don't have any financial disclosures. So distal radius fractures are one of the most common fractures seen in the upper limb. They account for around 18% of all fractures. Mechanism of action is usually fall on outstretched hand. Risk factors usually you've seen in adults it's high energy trauma, and in elderly it's osteoporotic individuals. These are the concept behind the three columns, in which the radial column, intermediate column and ulnar column, these are the things which we try to reconstruct or achieve a good reduction in a closed reduction. So in our case study we had around 29 cases. It was done between 2018 to 2023. We had 15 males and 14 females. The technique which we used was the patient was anesthetized, had general anesthesia, something like propofol or brachial block. This was preferred by the anesthetist himself. We had two assistants. A short arm board was used. C-arm definitely was used. The wire size which we used in our cases was 1.5 to 1.8 mm. So it's a very simple technique. We give longitudinal traction, see the reduction on the C-arm, and the pins. I think a lot of you, if you've gone through the literature, a lot of people do the 5-point fixation. So it's something in between it. We use two pins which go along the radial styloid. The third and the fourth pin go from the superior aspect of the radial styloid and are directed towards the lunate fossa. The fifth pin which we use is used to stabilize the DRUJ joint. And sometimes we require extra wires which we can use if we feel that there are some fragments which are missing out from our fixation. And definitely after insertion of every wire, we check under C-arm to see in both AP and lateral views to see the position of the wires. So this is one patient, 41-year-old female. She fell in our house. She was a teacher, right hand dominant. You can see this is a comminuted fracture. Also has some amount of intra-articular extension. So these are the C-arm views in which you can see the first wire is directed from the radial styloid, and subsequently you can see the second wire which is also going from the radial styloid. The third wire, this is sort of the wire which Dr. Jakhan was talking in the morning, which we insert, and it is directed towards the lunate fossa. After this, we can insert a second wire which is also directed, and it tries to span out inside the distal radius cavity. So this is the immediate post-operative fixation, the X-ray. This X-ray is after 6 weeks. This is after the wire removal. So these are comparative X-rays which we recently took. So both the wrists are there to compare, the wrist joint. Very difficult to even assess where the fracture was. It's a very simple technique. This is the results at 5 months follow-up, ulnar deviation. Radial deviation. This is the plantar flexion. This is dorsiflexion. This is a pronation and supination, full range of motion. Another 67-year-old female injured in August 2021. She fell on the wet surface. You can see this is the extra-articular distal and radius fracture. Also had a distal and ulnar fracture. So this is what we did. Also supplemented her with a DRUJ joint K-wire. So this is at 6 weeks after her wire removal. So this is a 2-year follow-up of this lady. She has full range of motion in her wrist. A happy lady. This is another patient, 34-year-old male, a very bulky patient. He twisted his wrist while doing gym with 45 kilograms dumbbell. He had both of those dumbbells in his, was trying to do his workout, and he came to the OPD. Surprisingly, he said, "I don't have pain. You know, these people are really pumped up." And you see a lot of swelling. Got his X-ray done. You can see he also had intra-articular combination. Also had a ulnar styloid fragment. So this is the standard procedure which we do. This is at 6 weeks. Another 77-year-old female. So results, all the fractures healed. Mean time to union was 8 weeks. 25 patients achieved a range of motion around 0 to 100. Pin site infection occurred in 5 patients in the pin sites, but only 1 patient required selective pin removal before 6 weeks. No radial sensory nerve injury. The overall results were just as satisfactory in 26 patients. Challenges which we usually face in percutaneous wiring sometimes is, we have a lot of bulky wrists. And post-injury, there's a lot of swelling, sometimes poor condition of the skin, uncontrolled diabetes because these pins are left outside the skin. Anesthetic complications can be there for these elderly patients, especially nowadays. A lot of patients have these diabetes and hypertension. And one difficulty, which I would say that for these patients in which percutaneous wiring would not be really suitable, is if these patients have a die punch fracture fragment. And in a volar Barton fracture, it is very challenging to catch the fragment, especially if there's a volar lunate fragment or a dorsal lunate fragment. Because otherwise, if we have to put these wires from this side, the median nerve may be at injury. These are some tips while we do this percutaneous pinning, that the pin should be placed seeing that they don't impinge the skin. Sometimes there's a lot of swelling, and while we're drilling these wires percutaneously, the ends of these wires, they tend to touch the skin, and this may be a cause for pin tract infection. So trajectory is important. The pin should be bent away from the skin with a proper instrument as a plier and a wire bender. And we should be careful that when we try to bend these, the pin can back out if only the plier is not pressed well, or in case we just have a single person, he uses the wire bender and he tries to bend it. Sometimes the pull can back out. And another small tip is that the dressing should be trimmed under the pin. So I usually take a gauze piece, put a very small piece, sometimes use sumac also, and just slide it underneath the pin. And other thing is sometimes because these patients do come for follow-up at 2 weeks or 3 weeks. Sometimes if you ask a nurse or an assistant to just take off the plaster, the pin can come out with the dressing also. So I always tend to place a single gauze above it, and 2 gauze help in accidental pin pull out while the dressing change at the time of dressing change. So in conclusion, percutaneous wiring is a safe, cost-effective surgical method to stabilize distal radius fracture. It can be used as a method with least chances of deep infection and soft tissue problems associated with internal fixation, which is as high as 9 to 60%. This is as per some report. It's a bloodless surgery. Surgical time required is very less. Chances of collapse are less when we compare it to conservative methods. And I've been trained in Rohtak, and Dr. Sangwan always used to say an acronym which was called KISS. He said, keep it safe, short and simple. So I think this is a very simple technique, and we can use it quite effectively for many patients who have extra-articular distal radius fractures and are willing for surgery, because sometimes cost is a factor which plays, and a lot of patients do not want to have plates because they feel that it may be need to remove, or and the cost of surgery. Thank you very much.
Now I request Dr. Suroi sir, please state Dr. Gaurav Sanjay.
Thank you.
Thank you, Roy sir.
So I got the experience of the 40 years of the orthopedic surgery, doing the surgery in the different place, working in the bigger institutes like AIMS and PGI and the International Institute, then in the smaller place or the my place as we are practicing in the, I am practicing in the Dehradun, which is the smaller place considering to the metropolitan city of our country as well. So the wide exposure and wide experience. I have given a slogan, health of the limbs are as important than the heart of the lungs, and the heart and the lungs. So this is what is the message which we want to give to all of you. Namaskar to all of you, and thank you Dr. Sirohi, who has given me this opportunity, as well as the organizing committee member, those who has given the opportunity to share my experience over here. As I mentioned that I have got this much, and in this many years, the scenario of the orthopedic surgery has been changed. Actually, I started the orthopedic practice just doing the thinking that I'll put the plaster because there will be the fracture, put the plaster. I was not that kind of a sincere student or the person as well. So very careless, because at that time the orthopedic surgeons should be having the little bit more confidence and little bit more build than the other colleagues also. And they were the successful orthopedic surgeons at that time also. But recently, this has been changed. Locomotion is important at every stage of life. However, it is more important in the childhood. Normal walking contributes a lot of the overall development of the any child. It is not the genetics alone which it is changed. It is the environment you experience with the locomotion only. 40-50 years back, amputation was almost in emergency treatment of the road traffic accidents. Now the incidence of the amputation after road traffic accidents is negligible, but the incidence of the deformity, disability increasing, which we have seen in the 2 days in this our conference. AO and Elizarov has contributed a lot to reduce the deformity and disability after the fracture. I have been the fellow in the 1988 in Switzerland and August 2001 in Elizarov Center. Education is important in shaping the life of everyone. Education gives employment. Employment gives the empowerment to the individual. But any one of can get the education if he or she cannot go to the school. I believe health is not only an asset but a resource too, which should be nurtured by all. And I propagate this message. Health should be an urgent and important priority of all government and non-government organizations, and private and government sectors should complement to each other rather than we should be the competitor. According to Government of India, 2.1% of the Indian population suffers with the disabilities, and 24% of them are the orthopedic disabilities. Being orthopedic surgeon, I confine myself talk to the orthopedic disability related with the locomotion. Human resource is the greatest resource on the planet Earth. Locomotor disability means a problem in moving from one place to another. That is the disability mainly the legs. Locomotion is important at every stage of life. However, it is more important in childhood, as I mentioned earlier. Normal walking contributes a lot for the overall development of the any child. The plight of the children, it is mentioned in this lecture. The children are suffering a lot due to locomotor disability in our country, as it is highlighted in this column. CTD, CP, polio, CDI, perthes, poliomyelitis, myopathy, scoliosis, rickets, infection, trauma are the main causes of the orthopedic disability in the children. Recently, the iatrogenic causes are also being increased due to poor training and lesser experience of certain orthopedic surgeons, which you have seen in the past speakers as well. Polio had been the main cause of the deformity disability, but now the road traffic accident has taken over the disability. More people live with a disability today than ever before, though the polio has been eradicated in our country. The deformities related to infection have been significantly reduced in the last 40 years due to better socio-economic and healthcare services. The flexible deformity can be corrected with plaster.
The pioneers आपका आप लोगों का regularly call आता है क्या? देखना सारे pioneers
guest column.
Surgical results reveal what surgery often can achieve in hours. Physiotherapy cannot be a year, and sooner the surgery, better the results. Hundreds of patients of orthopedic deformity have been operated by me with a significant improved result. In certainly properly selected cases, quality surgery and a regular follow-up of these patients have given such good results that after 5 to 10 years of surgery, it is difficult to say if these particular children ever had any deformity in the past that you will see. As I said earlier, the incidence of disability due to congenital developmental infection including polio had been reduced, but the road traffic accidents are causing havoc in our producing significant deformity and the disability that we will see in the future life. Deformity and disability caused due to any reason affects the individual, family, community and the nation. And there is link between the poverty and road traffic accident and related disability, deformity. This is a person, 14 years old, snake-like deformity. He has been thrown from the house because of this disability, because he was going to the dependent on the poor family, and this is the real situation. He came to me, and this is what I have written in this slide. आस्था से पहला कदम उठाएं, आपको पूरी सीढ़ी देखने की जरूरत नहीं है, बस पहला कदम उठाएं. That I have written in my OPD, and I tell to the patient, just have a faith. And this is the simple thing. This procedure, this surgery has been done in 2010. I was not aware about the external fixator. Simple, this just fixator has been done first in the one plane and then in the two plane, and then multiple surgeries and deformities has been corrected gradually. And this is what distraction, then the plating, then this at this one stage he got the necrosis of the skin. I was worried that now patient will go into the amputation. So you should have the lot of empathy, and patient should have faith in you, because if that thing happens, what will happen to you as well as to the patient. And these are the results after the surgery. He is expressing the gratitude to me. This is the man you see, 35-year-old male, unmarried, shopkeeper. Injury occurred in October 2021. Almost 2 years. Shop is closed since day of injury. In fact, I inquired about how much he was earning. He was reluctant to tell me how much he is earning, because he thought probably if I tell the more money, probably Dr. Sanjay will ask for the more money. I say you whatever has been fixed, that will remain, it won't change. He says I was earning only 5,000 rupees a month. You can imagine in 2 years how much he has lost. If he was the rich person, probably he got this surgery. And this was the situation, and then you can see the deformity over here. It has got this much correction of the deformity with the elixir of, and I am not going to, I have decided that I will not open the fracture, I will heal this fracture, and there is the, say, some sort of the arrangement between me and my son, who is also the orthopedic surgeon. He says, Papa, ना इसमें तो कुछ ना कुछ करना पड़ेगा, खोलना पड़ेगा. मैंने कहा नहीं बेटा, मैं इसको ऐसे ही जोड़ूंगा, देखना अब who wins, whether he or me. But anyway, whosoever wins, everything is in the family only. The need of the people with disabilities are the same as that of the non-displaced person. You see, this patient has got the surgery. He came to the surgery only when he was not unable to do the potty in the squatting position. He was doing that procedure in the standing position, and that was the reason that forced me and to him to do the surgery for this patient. डॉक्टर साहब कुछ ना कुछ कर दीजिए, बड़ा और जानवरों की तरह मुझे हंगना पड़ता है. Thumb amputation. You can see how much the disability. This has been corrected. This boy has, the girl has done herself in this thing. She is amputated early. Thumb has been reconstructed by me only, lengthening, and the plastic surgery. I do the flap surgery as well as I do it. And you need the disability with the finger amputation after the road traffic accident. And the day of birthday, she was going the celebration, and she got it this kind of. This has been corrected. We could not do the lengthening because they were not concerned, but I did. Foot disability. They are fit for the amputation. Surgeon suggested few of the doctors should fit for the amputation. Even this foot can be salvaged, and this is what has been done for the girl also. CTV deformity, very crippling deformity, but they can be corrected, as you can see over pre-operative as well as the post-operative photo over here. This one and this one. This eye paper presented in the Chongpeng. This was yesterday was the discussion. There is one of the radial head dislocation has been reduced openly, and that's why I said it as yesterday as well that I request you, sir, wait for tomorrow. I'll show you the. This has been correct. The radial head as it is not been open. It's only the closed reduction with the help of the Elizarov, and only the one wire. If you can see it, this is very precisely has been gone into the bone, and that has gradually been pulled to bring into the radial head, and you see the results. The earlier the ulna was fixed, distracted plate was removed, and lengthening was pressed. Both graft was done, and the radial head not had to be removed. Other girl, this is the Brown disease. Surgery has been done. Deformity, recurrence of the deformity came to me. I corrected the deformity. I knew this deformity will recur, so I did the overcorrection. If you see the corpus in two places, and the deformity in fact recurred. In 2016, you can see over here in this slide, and again surgery has been done. Recurrence has been corrected with the same Elizarov, and this is the curve. So this is the contribution of the orthopedic surgeon towards the society. A small girl, 9 months old, deformity, infection, corrected with the simple osteotomy and the simple fixator as everybody is having, because these are the just thrown away price. That's the girl, again with the simple procedure. Cut the bone, fix with the fixator, forget about the infection, what is going to happen. God is great, and they get the benefit. This girl, because of the decades, boil the both left femur tibia, corticotomy has been done, fixator, ordinary fixator, and this has been corrected. Because otherwise, the girl has been become the old, बूढ़ी हो गई थी बचपन में ही, जैसा कि आप यहाँ पे देखेंगे. This has been corrected with the STO, high degree osteotomy, which we do it, and this is the awfully. I couldn't show you the video, and this one. Very interesting picture. This is the deformity. 4-year-old girl who came to me, not able to walk. The simple procedure just is the innovative. अरे यार सब deformity कर लेते, इसमें भी fixator लगा देते, and that's what I had done. I was not aware about what can be done, and just innovative and just with the confidence and faith of the patient. Deformity correct kiya, and now this girl, she is 17-year-old girl now. This has been taken in 23 and procedure has been done in the 24. You can calculate that. She is the 17 or she is 9 or 20. But the problem is still she cannot bend the knee. She is already in the standing. This deformity, people certain time they could not come in the childhood, but later on the assisted not help too much. Otherwise, the deformity can be corrected at the young age also. The another picture, graft has been removed, infection secrestum has been removed, bowing of the ulna, shortening of the ulna, radial head dislocated, ulna has been lengthened, put with a simple finger graft, one side healed, other did not heal, head is still dislocated, radial head at the later stage, ulna has been lengthened. Head has been reduced without opening the radial head with the simple principle, with the simple experience, because this I did it. That's why I dared to do in the adult patient as well. The forearm, right forearm was shorting. Then I did that. Say the ulna was shorting, radial was still. Then I lengthened the both radius as well as the ulna on the right side to make the forearm equal to them, and that you can see it. Smaller deformities like this, humerus, simple procedure. Simple procedure they can do it. In the Farthi, I use this thing. This is the dislocation here. Corrective osteotomy. People are, अरे यार केवाई डाल दोगे क्या हो जाएगा? कोई नहीं, जितना भी होगा देखा जाएगा. At least the girl will be able to walk. That's what I done it. Farthi, in fact, I use this fibular graft, considering the same principle. If the neck can heal, why not the epiphysis as well? And epiphysis also is vascularized and became the normal. Slip capital epiphysis, because patients come to doing the private practice, all kind of the patients come. In situ, fixation, and he became alright. I couldn't show you the video and all that. 26-year-old girl, everybody is discouraging me. अरे डॉक्टर साहब 26 साल में क्या करोगे? कितने साल हिप चलेगा? मैंने कहा यार क्या करना है? एक बार नॉर्मल चलेगी, कोई लड़का देखेगा, शादी हो जाएगी, बाप को पुण्य मिलेगा कि कम से कम लड़की की शादी कर दी, और लड़की की शादी हुई. और मैंने ये भी कहा कोई बात नहीं, आज बाप करा लेगा, यदि फेल हुआ तो फिर फादर इसका हस्बैंड करा लेगा। दिस इज व्हाट इज हैपेंड। और ये रिवाइज करना पड़ा हमने जो हिप आपने किया था, इसकी बेटी ने कराया बिकॉज हस्बैंड इज आल्सो डाइड अनफॉर्चुनेटली एंड शी हैड गॉट द सर्जरी। सो दिस इज व्हाट आई फील ऑफ मोस्ट ऑफ द ऑर्थोपेडिक सर्जन कंट्रीब्यूटिंग फॉर द सोसाइटी डेवलपमेंट एंड द congenital and prenatal bowing of the tibia। बड़े लोग डरते हैं यार करेंगे इन्फेक्शन हो जाएगा, एम्पुटेशन करने पड़ेगा। हमने कहा कोई बात नहीं, आप क्या करते, छुएंगे नहीं, न रहेगा बांस न बजेगी बांसुरी, उसको छेड़ेंगे नहीं, ऊपर नीचे फिक्सेटर लगा दिया, ग्रेजुअली डिस्ट्रैक्शन किया, and the distraction it is healed. Now the child is his father is the Granthi in the Singapore and the Gaurav has got the in fact the hospital to the tumor bone graft। इसके लिए यार एक टांग कट जाती है तब आदमी की कितनी डिसेबिलिटी होती है। दैट इज व्हाट इज द osteosarcoma has been removed and autoclave and put it back and it is degenerated and the girl is living in this Dehradun only। This is almost 14 years now, 30 years so married है, बच्चे हैं उसके। अभी मेरे से पूछ रहे डॉक्टर साहब शादी कर सकते क्यों नहीं कर सकते, गाली पूती बच्चा कर सकते क्यों नहीं कर सकते। Then you have become a normal। इसको स्ट्रांगली बिलीव करते हैं वन लेग इज बेटर देन नो लेग। दोनों एम्पुटेशन से नहीं, एक से हाफ कर सकते हैं जस्ट लाइक कंगारू एंड दैट्स व्हाट आई डू इट। इसको हमने एक एम्पुटेशन हो गया था, दूसरी पैर में इन्फेक्शन था, इसको हमने सेव किया, शॉर्टनिंग की, लेंथनिंग की, मल्टीपल ऑपरेशन। आई टेल इन वन थिंग टू द पेशेंट, आप इस बात की चिंता ना करो कि मैं ऑपरेशन 1 करूंगा 10 करूंगा, आप एक ही बात रखो, आम खाने से मतलब रखो, पेड़ गिरने से नहीं। ऑपरेशन 1 कर सकता हूँ, दर्जन कर सकता हूँ, बस इसी तरह से काम करता हूँ, लोगों को यही बताता हूँ, यही कहता हूँ। दिस द एंड पेशेंट, वन लेग इज बेटर देन नो लेग। ये देखिए डॉक्टरों का हाइड्रोजन जैसे कहते हैं हम कितना करते हैं। बच्चे में फ्यूलाइजेशन टिबिया कर दिया, रिजल्ट्स आप देख रहे हैं। रिलेटिव ऑफ द वन ऑफ माय स्टूडेंट्स हु ब्रॉट टू मी, मैंने करे देता हूँ, इसको पहले निकाला, सेपरेट किया फिबुला को, इसको किया सेपरेट कर दिया, लैंडिंग कर दी प्रॉक्सिमल और डिस्टल, टिबिया नॉर्मल हो गया। अब आप इस पिक्चर को देखिए। कई लोगों से कहता हूँ यार ये बच्चा जाएगा तो इसके माँ बाप क्या कहेंगे, मैसेज देंगे, डॉक्टर साहब के यहाँ तो बच्चे भी बदले जाते हैं। देखिए आप इस बच्चे को और इस बच्चे को, कोई कह सकता है वही बच्चा होगा। तो हम लोग इस तरह के कुछ काम करते हैं। I believe that orthopedic surgeon of our country can play an important role to prevent and correct the deformity, and that's it. One of the girl CTV band एक बहुत सी चीजें हैं और जिनको है deformity। I also believe the health of them is as important as the heart of the lung। जैसा कि मैंने पहले कहा, I believe whatever mankind has achieved by now is mainly due to locomotion, be it war or in peace। If all of us had not walked on our feet, we would not have reached where we are today। This conference and the following photos are the proof of it। जब एक बच्चा आया, we can be happy only if we are healthy। आपने सुना होगा अस्पष्ट के बारे में ना 8 ही डिफॉर्मिटी थी। आप सब ऑर्थोपेडिक सर्जन ने गिने साहब इसमें कितनी डिफॉर्मिटीज, दे ऑल नीड द करेक्शन। और सब नहीं करती तो बच्चा चलना लगाएगा, शायद चलने लगा, दौड़ने भागने से बहुत सी डिफॉर्मिटी इसकी अपने आप ठीक हो जाएगी। इस सो पुअर, हमारे बगल में रहता कुठाल के, कभी उसे पता ही नहीं चला कि हम और आप क्या हैं, जबकि हमने उससे क्या, हम तो बड़े बार अखबार में नाम आता। लोगों के साथ इतनी इग्नोरेंस है, एंड दैट्स व्हाट दे नीड द अवेयरनेस। इफ वी वुड नॉट हैव वॉक्ड इन द चाइल्डहुड, देन वी वुड नॉट हैव रीच्ड वेयर वी हैव रीच्ड टुडे। आवर प्रेजेंस इन हॉल इज प्रूफ ऑफ इट, एंड दीस आर द फोटोज आर द प्रूफ ऑफ इट। And because of that, I say any type of disability can not only physical harm but also mental, economic, social loss. The need of the people with disabilities are same as those of them. The longer the disability lasts, its ill effects increase proportionately. Government, non-government organizations, society should try to prevent any kind of disability. The correction of the deformity should be done as soon as possible because I believe the plants can be straightened easily, not the trees. पौधे सीधे किए जाते हैं आसानी से, पेड़ नहीं। The perception of the common people is that children should be operated only when they become mature, but sooner the correction, better the results. That's why I propagate all the time and say to them. Thank you very much.
Thank you very much. Such a vibrant speech. Thank you very much. Thank you.
Last message, only the draft draft is the do right at the first time, because repair and redo are costly affair which we have seen in this conference and we are seeing each and every day. I request and appeal to the all orthopedic surgeons, unless it is perfect, don't say to the anesthetist the surgery is over.
Thank you.